Hello everyone. We welcome all our viewers to this inaugural session of Facebook Live on the occasion of World Heart Day. And as you know, today's session will be on heart failure, and we have two very eminent speakers with us. We have Dr. Debdutta Bhattacharya on my right, who is our clinical director and Cath-Lab director too, and he's the division chief of cardiology. And on my left-hand side, we have Dr. Mrinalendu. He is the head of department of cardiothoracic surgery. And as you know, we've made immense advances as far as cardiology is concerned. So the way we treat coronary artery disease today is much different from what it was about a decade earlier. But one of the unmet needs of cardiology happens to be heart failure. And heart failure happens to be that diagnosis which often patients are given to, and it almost sounds like a death knell, where our treatment options are limited. So today, as you know, in this little session, we will talk to Dr. Bhattacharya as well as to Dr. Das regarding how we are treating our patients of heart failure, what are their options like, and we want you to know that there is a lot of treatment options, and that's how we intend to proceed. So, sir, we'll begin with you. So, in your busy OPD practice, how frequently do you see such patients of heart failure?
Thank you, Ayan. Heart failure is a very common condition these days. As you rightly pointed out, that we have made strides in the treatment of coronary artery disease, and the treatment of coronary artery disease has changed over the last 20 years. In fact, it has been revolutionized since we started Ayan Kar Hospital, and we are treating thousands of patients with coronary artery disease, and a lot of them are gaining a new life. But unfortunately, some of the patients with coronary artery disease, they come to us after their LV function, or the heart pumping function, has become compromised. And these patients do not respond very well to bypass surgery or angioplasty. And despite all the measures, these patients continue to decline because the pumping power of the heart is not good, and these patients develop what is called heart failure. Apart from coronary artery disease, of course, there are other causes of pump failure, dilated cardiomyopathy being one of the most common other cause, apart from coronary artery disease induced poor left ventricular function. And apart from that, we also have valvular disease, we have congenital disease, we have other types of cardiomyopathies, which can also give rise to progressive pump failure. And these are the patients that all cardiologists in our institution, as you know, we have 20 cardiologists here, they see regularly. At least we see 30 to 40 patients with compromised left ventricular function every day in our outpatients.
So as correctly Dr. Bhattacharya says that of course you understand that the amount of patients that we are seeing in our OPDs is quite high. So on that same note, let me ask Dr. Das also that, sir, amongst your post-bypass patients, post-valve patients also, I'm sure you do see a few patients who end up with heart failure. So I think that also is probably a place where we have a lot of options for treatment. So what is your take on that?
Yes, we have treated a large number of patients with our surgical skill, be it bypass surgery, valve replacement, or congenital heart diseases. But most of them do well, but some of them really later on, or even some of these patients are not treatable surgically, like doing bypass or valve replacement, or even some of the complex congenitals where there is no actually surgical specialty to treat them. So in those patients, these patients go on heart failure. So we have ventured into the new era of treatment, surgical treatment for heart failure. That is, there are two types of treatment available now. The most important is heart transplantations, and of course, some of the patients are not suitable for heart transplantation, and they have mechanical assist devices. There are several devices. So that is how we are approaching this group of patients who are not amenable for complete correction with surgical treatment, be it coronary artery disease, valvular heart disease, or even complex congenital heart disease.
I'll just interrupt you there. So as you now realize that it's not just heart attacks which results in a weak heart, you have also weak muscles, you have valves, you also have congenital heart disorders which are all responsible for heart failure. So now I'll come back to Dr. Bhattacharya. So how are we treating these patients as an OPD basis? How do you think is the therapy? What are the limitations? Do you think it's adequately treated?
As you know, on that heart failure treatment by drugs has evolved over the last 30 to 40 years. 40 years ago, there was only diuretics, only one class of drug that could treat heart failure. But towards the end of 1980, more and more drugs started coming into the practice of cardiology, and that has revolutionized the treatment of heart failure. And although we see a lot of patients who have poor LV function, it is not that these patients cannot be treated. In fact, they can be treated for a very long time, 10 years, 15 years after the diagnosis of heart failure, and they continue to do their normal activities. Yes, they are restricted, they are not like normal people, but it doesn't mean that if you have a pumping power of 30% or even 25%, that you immediately, it is like a death sentence. Yes, these patients need to be careful. They need to maintain their diet, their fluid intake, their salt intake. They have to be careful about their exercise. If there are any underlying factors, aggravating factors that can be corrected, we should correct them. And then there are drugs. There are at least 3 to 4 classes of drugs in heart failure, and even as late as 2010, 12, and even last year, we have been having newer drugs that are coming into the market, which are effective in the treatment of heart failure. So when we find a patient with heart failure, we try to find the cause, we try to find any reversible causes that can cause progressive pump dysfunction, and then we have drugs. These drugs have to be introduced carefully and cautiously, because each of these drugs have their side effects, and they have to be titrated, or which means their doses have to be increased gradually to the maximal tolerated dose. And we see that a lot of patients, they respond to this treatment. However, as Dr. Das was saying, that there will be some patients who will not respond. So you have been treating some patients for a long duration of time, and then a time comes when they do not respond anymore. Or you can get some patients who are so sick that they do not respond to any type of treatment at all. And those are the types of patients that need even more advanced treatment than drug treatment.
So it is important to emphasize on the fact, as Dr. Bhattacharya says, for all those viewers with heart failure who are logging onto the site to see us, that do not lose hope. There are a lot of treatment options available. We have very good drugs. Especially, I think we have a new molecule known as ARNI. It's called ARNI. It has revolutionized the way we actually treat heart failure nowadays. So before we go forward, sir, so as you were saying towards the end of your last talk, that you said that a certain amount of patients don't respond to these drugs. So what percentage are we talking about, and what are their options like?
So if you have 40 patients coming to the outpatients department every day, you will find that about 10% of these patients, they are very sick. And these patients require hospitalization. And after hospitalization, what we try to do initially is to manage them with intravenous medicines. And some of these patients again will respond, and they will be able to be discharged home, and they can go home and lead a normal life at home with certain restrictions. But of those 10% of patients, there will be some patients who will not respond even to intravenous maximal therapy. And those are the patients that then we are really at the end of the road with medical treatment. So it is a small segment of the heart failure population who needs it. But in that segment, there was previously no hope. And presently, what we are doing in this hospital, and Dr. Das can elaborate more on that, that we are going to options beyond for this very select group of patients where nothing works. We are offering newer treatment strategies, and you can ask Dr. Das about it.
So as we are talking about, so right now we are transitioning from a phase of what is known as basic heart failure therapies, and as I told you, there despite the best measures given, there will be a certain proportion, albeit it's not a large proportion, who will require advanced heart failure therapies. So now I will go to Dr. Das. So when medicine fails, sir, so what are the surgical options that these patients are presented with? And can you tell us, before you get to there, I mean, before you discuss these options, so what are the challenges of heart failure as a surgeon that you find in your OPD practice?
Well, thank you, Alan. I take it from where Dr. Bhattacharya's lab that there are millions of patients who are in heart failure and being treated in the outpatient department for with various new upcoming drugs and all. But then again, about 8 to 10% we will need advanced treatment for heart failure, like heart transplantations or some of the assist devices. So the problem which we are facing first of all, to identify this group of patients, convincing this group of patients that yes, there is a treatment beyond medical treatment and you can probably get better and have a very good life and with increased longevity, because most of these patients are in a very productive age group. So we are looking at patients with about 40 and 50 years of age group where they have a lot of family commitments and all. So we can provide these patients with the advanced treatment of heart failure like heart transplantation or assist devices. So you have to get convinced that yes, there is a treatment and it is possible and I can have a good life with this kind of advanced treatment. So that is one of the challenges, convincing and people accepting this kind of heart transplantation and advanced treatment. Second part here is that this is of course not beyond complications. It involves a lot of costs also and a lot of restriction to their life in the beginning part of life. So all those things they have to be convinced and they have to come forward and enlist themselves with the heart failure registry and enlist themselves for the heart transplantation. And second important thing is that the chance that somebody is waiting for a heart transplantation, in that case we need to have a donor. And because heart is a single organ, it has to be a cadaveric transplantation. So we need to have an organ donation, and that organ donation has to come for heart transplantation. So awareness for the organ donation, there are several thousands of people probably dying all over the country, particularly patients who are in brain death, but their heart is working. So those are the people who are suitable for heart donations. So getting convinced about heart donations and donating heart and give a life to somebody who is really sick. So these are the challenges which we are facing. But obviously the things has improved. If you see from 1994, when the first heart transplantation was done in India, in All India Institute, till about 2014-15, we have done only 350 transplantation in all over the country. But after that, there are central organizations like NOTOS and SOTOS and ROTOS has come, who actually has revolutionized the organ donations and allotment of the organ in a very proper manner. And since then, in 2016 to 2018, about 300 heart transplantation has happened in all over the country. Not only the first tier cities, even second tier cities also. So there is a tremendous advancement in the treatment of heart failure, surgical treatment I'm talking about. So there is a prospect, there is a hope, there is a light of hope. So everybody should understand and come forward to receive those treatment, both in terms of getting heart transplantation done and helping other people in terms of donating their organs. So there is a lot of propaganda about it.
So I think that's correctly put. So we have a huge, I mean, it's the beacon of hope out here. So for heart failure patients with end-stage heart failure, I think we have something which actually gives you something as good as a new life. So we are talking about heart transplantation. So on behalf of this whole team out here, what we do intend to tell you is that there is a certain inertia that is required within our population for donating organs. As Dr. Das rightly said, heart is a single organ and it cannot be taken from a live donor. It has to be a cadaveric donor. And unless and until there is this propaganda within the population whereby you start donating organs more often, you will not be able to really give hearts to the people who actually need it. It will make a big difference to their lives. So, sir, before I go back to Dr. Bhattacharya regarding this, I would like to ask you that when we did our first transplant, what were the challenges that we faced? And I think you've been part of transplant programs before also outside India. And so we would like you to give us a little bit of your experience both abroad as well as in India about the heart transplant programs and the challenges, and probably in a few words about what we did and how we went about it.
Well, first of all, our training abroad, it's a very structured program. We were mainly involving in harvesting the heart. We used to travel far abroad across the country in a jet plane and harvest the heart and bring it and then assist in doing the transplantation, because everything is so well structurized and well coordinated, I must say that. So basically what we learned there is a teamwork, that you need a coordinator, you need a group of people, surgeons who can harvest the heart, another group who will reimplant the heart into the recipient. So when we came back to India, a little bit disorganized, and we took about 3 years to organize ourselves so that we can do the heart transplantation. So we organized, there was a big meeting between the cardiologists, cardiac surgeons, and also the coordinator, and finally we succeeded. Though I must say that it is not only one person who implanted heart or brought the heart, it is a big teamwork. The first transplant which we did in Ayan Tagore Hospital last year in September, this lady was a 29 years old lady, mother of 2 children. She suffered from dilated cardiomyopathy after second child delivery, and she could barely, as you remember, walk few steps in few meters. And then we enlisted her for transplantation. After a couple of sort of setbacks, she came and went back, did not get a donation, but finally we managed to get a donation that was quite far off from Calcutta. Actually, initially first few transplant in Calcutta, if you have seen, all donations have come outside Calcutta. So we brought that heart from Patna in a commercial flight, and with a very coordinated manner, we reimplanted the heart in the middle of the night. You know the ischemic time, that by the time the heart is explanted from the donor and reimplanted into the recipient, so that time limit is very important. If it is beyond certain period hours, then heart doesn't really function. So we could manage to put that heart back within 4 hours, right from the time of explantation. So it was a big challenge, but I must say that there's a big coordination from all of us, and we could do it. And subsequently, you must have seen, there are so many transplantations that has happened in the city. So it is picking up, and these challenges will be overcome. And hopefully that we will be able to perform more heart transplantation, provided we get cooperation, both in terms of those who need a transplant to come forward for this treatment, as well as the donation, as we have discussed.
So it's important to realize that we are talking about networks not within the hospital, we are talking about a large team, we are talking about working 24/7, we are talking about interaction with government agencies, and of course at the end of the day, it has to be the public. It is important to have public awareness. So we'll again stress on the fact that organ donation is a major issue and it needs to be done. Only then can we give a new life to some other people who actually need it. So, sir, after transplant, I think I've had the opportunity with Dr. Bhattacharya to follow up this patient who had our first transplant. So I think you could tell us, sir, about this patient and how we've been seeing her for about a year now. And and I think she looks fantastic compared to what she was before.
Yeah, I mean, she's almost going to complete a year, probably in another week's time. And she has gone back to normal life. She can do all the things that is normally expected of a woman of her age. But she has to come for follow-ups, and she has to take some medicines because, as you know, that it is a heart from another person. So when you transplant an organ, there is always a tendency for the body to reject a foreign organ. So we have given her drugs, and we have taken biopsies from her heart, to see that the heart is not being rejected by her body. And so far, her response has been very good. And we plan to again see her again in a few weeks' time when she completes a year, I think.
So that's the good news, that we will be seeing her, and she's done amazingly. She's put on weight, she's eating whatever she wants, she's now going for a walk, she's taking her kids to school, she goes running with her dog. So we've brought her back to normal life. So that is what the advantage heart transplant actually gives you. Now there are certain patients. I'll come back to Dr. Das now. So there are certain patients who are not fit for transplants also. I mean, I would probably, you could tell us what kind of patients we are looking at, and maybe then you can tell us that is there anything else we can do for those patients apart from, of course, medicines and transplants is not an option for them. So what else are we looking at? Do we have something more novel?
Yes, there is a very select group of patients who has failed their medical treatment, who are actually not suitable for transplantation, because transplantation has a very strict and rigid criteria who can be transplanted. And those group of patients, we can afford to provide some kind of mechanical support, which has also been revolutionary last several years, because first of all, the category of patients who come crashing and burning into the emergency, who's almost dying in massive heart failure, there neither you can do medical treatment nor you can do a straightaway transplantation, because they need to be listed, there has to be a donor.
Do not have enough
So,
time.
so there are mechanical supports like very short-term support, middle-term support, and then finally a long-term support. So short-term support we call as ECMO. We put them on ECMO. It is just a pump which takes blood from the venous system and pumps and reoxygenates it to the oxygenator and pumps back into the body. So it basically does left-sided heart function. So with that we salvage the patient, and then we decide what to do with him or her. So in that case, if the patient recovers, fine. If the patient does not recover, needs a longer term support, then we put them into a longer support system, which will probably a levitating device or a LVAD, which we call as a left ventricular assist device. So LVAD, left ventricular assist device, is a small device which can be implanted inside the pericardium. One end goes into the left ventricle, the other end goes into the aorta, by which it's kind of a small pump which is fitted inside, and it works very well. And it can take many months, even for years, the patient can survive on this support system. So those patients who have not been transplanted, or decision for transplant has not been taken, or there is non-availability of the donor and waiting in the list and they fall sick, these are the group of patients where we can put LVAD. The criteria are a little bit relaxed, like if somebody has a severe pulmonary hypertension, that means lungs pressure is high, in those patients we cannot transplant them, whereas we can put them on LVAD and they improve their lung function, probably can go. So it can be a bridge to transplant, or it can be even a destination therapy with the LVAD, where transplant can never be possible. For example, elderly persons, patients with a very huge body weight, all those kind of patients, we can put this VAD and then can leave on VAD. About 80% survive 1 year and beyond. So that is the therapy is available, and the VADs are becoming even smaller and smaller in size. So it becomes more, previous VADs were very big with a large battery hanging outside, but now they're all inside intrapericardial. So they're quite sleek and can be used for this purpose.
So as you heard, so there is no reason to lose hope as far as heart failure patients are concerned, and so we have more than one options apart from medicines. We have transplant, we have artificial hearts, so you have a lot of options to explore. So on a parting note, sir, I would ask both Dr. Das as well as Dr. Bhattacharya, I'll start with Dr. Bhattacharya, that so what would be your advice to a patient with heart failure?
Don't lose hope.
So rightly put, so it's not to lose hope. And so do you have anything more to say to such patients?
Well, first of all, prevention is better than cure. So they should be having healthy practice to look after your heart. You should have correct diet, exercise more, and then don't get heart diseases first of all. If at all you get it, there are medicines to help you. And if at the end of the day if medicine doesn't work, we have other options like heart transplantation and artificial devices to support you. So in way, we can give a full-fledged support for your heart, but then again, the most stress is on exercise and diet. And another important message to the public is please do pledge your organ, and if somebody wants to donate, there are different organizations with whom you can go and enlist your name, and donation is the best gift you can give to somebody, and we hope that more donation comes and more patients come for heart transplantation and advanced treatment.
So, sir, you couldn't have put it probably in a better way. So, prevention is always better than cure. So, on this occasion of World Heart Day, where the concept is of creating heart heroes within our public, within your neighborhood, within your office working spaces, it is very important that you get your 150 minutes of exercise per week, you eat your vegetables correctly, go low on your carbs, and make sure that you exercise on a daily basis. And as we said, as far as the NHWay is concerned, we are here to take care of most of your problems, heart-related problems, as and when they come. So I will thank both Dr. Das as well as Dr. Bhattacharya for joining us on this very interactive session and signing off from here. So wishing everybody a very happy World Heart Day.
Thank you.
Thank you.